So the topic today is whole health in 2025. Where are we now and where to next? And there are a lot of ways we can look at that. And I really want all of you to just really engage as we're moving through this if you can. Sometimes for me, I always tell people my brain really doesn't start working until about 9 a.m. But for those of you who are not as morning time impaired as I am, or just everybody, if you're willing to just push through, just really thinking about how this applies in the work that you're doing related to whatever that may be, but also just thinking about it in terms of how we as a group, as a community within the integrative health world at University of Wisconsin, make this all happen. And what does the future hold? I think that's a really important question. So our objectives, I want to level set for everybody. Some of you are newer to the UW than others, and I just want to make sure you have a kind of the overall history and the current state, where things are now. But I want to kind of keep expanding on that into, like I say, the future tense too. We'll talk about the expanding definition of whole health. It continues to grow and extend as we keep discovering more. It's a very iterative process. It's built around feedback, and so every single time we get feedback on a course or something that's written, or new developments occur, in terms of social policy or whatever, people pay close attention to that, and it infiltrates into the work that's done for whole health. That's true both at the VA level when they're doing it, but it's true in terms of a lot of the work that's being done at UW as well. And I'll talk with you a little bit about some research and some literature reviews, mostly give you resources to look at that more. And then talk a little bit about some trends that I see coming down the pike, just to kind of give you a sense of coming attractions. And then I really want to leave time for discussion. Where do we go from here? What happens next? What are some elements that allow us to keep growing along with all of the changes that we are experiencing worldwide? So I'm kind of stealing my thunder because I really want this to be the focus of the second half, but I want you to have a little time to reflect. So part of what I think of in terms of what do we all do, like what do we have in common, is that we bring about transcendence in any number of ways. That is, we help people, programs, everything kind of go beyond, right? So I'd like you to just take a minute and ask, when have you or someone you've worked with, or perhaps a client, patient, person you've seen, when have you seen healing occur, by going beyond in some way? And so examples of transcendence, that could be a breakthrough, where something more, that little something extra gave someone an insight to heal, achieving different states of mind or being that brought about something profound, just overall moments of mystery and awe. And when we get to that point, I'll have folks, volunteer to share if they'd like by raising their hand. Or also, if you want to put in the chat, that's also great. And I was just trying to give you a little format, which is simply X happened because of this or that. And so if you can think about that in just a moment, you might like to share. I always love this illustration of the guy poking his head out of the kind of the universe to kind of see beyond. I think a lot of us here are always trying to see beyond, whether it's solving a medical type problem or just in our own terms of our own growth as human beings or whatever. But yeah, so the phrase "per aspera ad astra," rough road leads to the stars, is an important one to think about. And I think we're all on very interesting roads, sometimes rougher than others. But what are we moving toward on that journey? So keep that in mind while I do a little bit of the more kind of practical stuff. So first, chop wood, carry water. You probably recognize these two lovely individuals here in this photo. And I bring this up because I think, as we talk about all this, we have to talk about the practicalities and some of the issues, that happen in the day-to-day world, first enlightenment, then the laundry or whatever, and I love this photo because it's kind of a bookend of leadership, right, within integrative health at UW, with Dave coming in and founding it in 2001 and Greta as the current director. I am glad I got to be one of the people between that bookend in terms of having the honor of being involved with the integrative health program for a while too. But it's just interesting to think about how things have changed. And as I was reflecting on this presentation, I just couldn't keep that out of my head. Back in 2001, the problems I think that Dave focused on, at least from my perspective as an observer, was, will they accept this whole integrative health thing or integrative medicine thing? If we supply all these services like acupuncture and massage and so on, will there be a demand? Will we be able to be functional? Will we be able to operate, financially in a way that works long term. And, it's just so interesting, to do all this work over the last couple of decades and, to try to promote it and have some of the things that we do become more sort of familiar to folks, more covered by insurance, that kind of thing. And the evolution now, I mean, this is how I kind of see it is in 2025. The question is not so much will they accept us, it's they do accept us. And now how do we keep up with such an intense demand? When I'm working in Science Drive doing consults, I'll have patients tell me, oh yeah, it's great. I'm really excited about my acupuncture visit in, 9 months or whatever. There's a wait, and that's okay that there's this high demand, but then this challenge of keeping up with the demands and continuing to move forward as folks think of this as just frankly another option that they can experience even within their health plans and their insurance and so on. So exciting stuff, and we have to just keep being iterative ourselves. So wanted to give you a little bit of a timeline here. This is the one slide history of whole health. I think it all began really when we started our integrative medicine program here back in the day, and it's evolved. We call it integrative health now. Sometimes whole health creeps in as well. But the bottom line is when Dave came here, Dave Rakel in 2001-ish, starting a program and taking a risk on the part of the Department of Family Medicine was really something, and just slow growth. I remember when we had one acupuncturist, among us all, and God bless the mindfulness program for being there every step of the way and so on, and the way we were able to weave in a lot of the offerings for courses and so on. But as things continue to slowly and steadily grow, health psychology, other groups coming in, we got attention. We're really, if you look at it, one of the largest integrative health programs in the world, when you draw in all of our different folks and everyone on the team, and people paid attention to that. And then 2012-ish, Tracy Gaudet, who had been fellowship director in Arizona when Dave went through, asked for us to help them create something that was initially billed as, hey, can you teach doctors in the VA about integrative medicine? And it then sort of morphed as people came together. This actually happened in the medical school in the Ebling Library meeting room. Folks started to talk about, well, we need to go bigger than that. It's not just about docs, and it's not just about trying to use any one term. And with sort of the different terms that are out there, or the different, call them schools of whole person health or whatever, it was really important to have something they figured unique to the VA. And many of you may remember Marite Hagman. She did a lot of work with us in the VA as the project manager. And she said, well, why don't we just call it whole health? And that it clicked, it stuck, just very inclusive. It's a little redundant if you take the Latin root of health is also wholeness, right? Or how, but it works. It leaves room for a lot of inclusivity, right? So, during this was all, the meeting occurred in 2013, and then we rolled out a first course in Madison, the VA, in 2013 as well, September. It was an interesting, prototype kind of an experience. And at the same time as we were rolling out these courses, we started to develop a resource library, which was pretty exciting because over time we had about 25 different people working on that. And a lot of them are affiliated with UW in some way, either some of our past fellows, people who are still here now, just a lot of folks did it. And, that community really built, I think, something quite remarkable. So, over time, we started with just a small 1-year contract. They kind of got through the second year with bits and pieces. And then in 2015, there was a 5-year contract. And during that contract, we were charged with developing new courses yearly. Folks still work on that. So for example, Vinny is still working on whole health for pain and suffering. Julia has been an incredible force in the whole health for mental health and well-being course that was designed, and so on. Started with whole health in your practice and just continued to grow. And those have become, through COVID and everything, more virtual in orientation too. But thousands, and I kid you not, thousands of people now have taken these courses, and hundreds of thousands of people have used the written resources that we put in there, which is pretty exciting. With the 5-year contract, we also had flagship sites, so representatives from each of the 18 regions in the VA kind of got up to speed with whole health. A lot of this was built around training the trainers or finding education champions who could then lead the trainings. There are now national and local and regional and other levels of education champions out there helping out. And with all of this too, came an awareness of the importance of thinking of this. As you'll see in a minute, the whole health model is framed within community, and this awareness of social and structural determinants of health, the things that come in there with us because of the context we exist in that have a profound effect on health. We can counsel people all we want, for example, about getting more activity in their lives, but if they don't feel safe to leave their home because they're in a challenging living situation, that makes for an impedance to their health care. So just kind of weighing some of those types of things in more, and even with the help of many of the people from our team developing a course in this and thinking about how to bring that into to bear. Now, in 2020, which many of us recall, was a year of lots of going on. The UW contract ended. A lot of the courses transitioned to being more virtual. There's also been a push more to make the courses more concise, just so that some of these started as 3-day kind of retreats almost, or 2.5-day retreats, and then trying to make it more accessible to folks in some ways by trimming it out a little bit, and trying to get to the meat of it, which is tricky. We can argue for both approaches. I think both approaches together are a good way to go. Um, there's during all of this, list one was getting traction. That's a list of different approaches in complementary integrative health that have the VA decided sufficient evidence to be covered. And those are now covered. That includes acupuncture, massage for pain, Tai Chi, Qigong, a number of mind-body approaches, including meditation training or mindfulness training. And it's just been really gratifying to watch as that's expanded and now is just considered part of, the veterans package when they join the VA. If a clinician thinks you need it, they will figure out how to get it wherever in the VA you are. And that includes some of these fairly rural areas, which makes it kind of an interesting challenge. The NASCM report I'll talk about a little bit more, but the National Academy of Sciences put out a report about how whole health really needs to be the model for our healthcare system in general. That was in 2023. As I mentioned, the SDOH courses continued to blossom. And then as of 2025, we just continue to see ongoing growth. I'll show you some slides around that. About 45% of veterans are experiencing whole health in some way, at least. And now the National Institutes of Health has been working with their whole person health model, which is a kissing cousin to the whole health model in the VA. We're seeing a lot more research. It's one of those things where if you look at on the National Library of Medicine and type in whole health, you just see just an explosion of studies in the last few years, which is really great. So that's kind of in one slide, the story. In terms of what we did at UW, we created over 600,000 words of written materials, 50 plus handouts for veterans, be used by anybody, and those are all available. It was your tax dollars at work, and they're all available online. I've got the link there if you're interested and haven't had a chance to browse through. In terms of the courses, again, tens of thousands of people have taken our courses combined with courses related to coaching and building up veterans skills with whole health as well. So the whole health in your practice course, as of last fiscal year, over 6,300 people had taken it. For mental health and well-being, over 1,400, and that's just a listing of some of the main courses that we'd helped create early on. And then there's also the Passport to Whole Health, which is a reference guide. Highly recommend it. The link is there. It basically goes through in a series of chapters all the parts of the whole health circle, which we're going to talk about in just a second. So we've got that ability to look at a reference guide. It's very evidence-based, and whole health has been very evidence-based throughout all of this, trying to look at the research. And then I'm using all this to train trainers, as I mentioned, but also it's now used in employee orientations, and whole health training is required not only when you're a new employee, but all of the mental health folks in the VA and all the primary care folks in the VA are now taking a course. We just finished a short course last year too that is designed to reach out to specialty care, inpatient, some of these other groups who need an overall introduction to what's going on. So fun to see, and not without its challenges. We don't want that little van, that perky little yellow van to break down, right? Challenges, which I think have been managed well within the VA and beyond, are the sheer size and scope. When you're trying to make social transformation happen or a structural transformation happen, it's tricky. and that can be a little bit overwhelming. In the VA, the part of the challenge has been that it's really clear that it's not the whole health work cannot just be a clinical thing. In the midst of our teaching contract, for that 5 years, there was that scandal in Arizona where veterans were waiting way too long to get services. And so all of a sudden, we saw that there was a real challenge getting certain folks, including a lot of primary care providers, into our courses because they were being asked, through all of these measures to be in clinic more to meet the demand. And so what we really saw is that a lot of other groups stepped up, which was wonderful. Psychology in particular in the VA has really been taking on a lot of the VA work, writing programs and so on. But there's the challenge of bureaucracy too. Every time an administration changes, every time different leadership comes in from different levels, the whole health programming responds in kind a little bit. Right now there's a big debate about how much to include certain terms in some of our courses, which has led to some consternation. And then really thinking about the challenges. The VA is wonderful. It's a great place to do experimenting, but they're also they have that ability to, yes, the VA centers are unique. The 150 or whatever there are now, and they're also overseen by one larger kind of system or national body that can ask for national level changes, like instituting whole health in different ways, which is great, but it doesn't always work in other systems. And so, one of the questions I'm always asking myself is, what does this look like for University of Wisconsin? We have that supply and demand issue I've mentioned earlier. We have this beautiful building of connections between departments that's happening, and still plenty of room for growth. And then there's this whole, I call them epistemological clashes, but basically, different perspectives on what constitutes truth. So I want this, right? I want the souped up, beautiful, different features, healthy, flourishing Volkswagen van, and really just asking ourselves, what does that look like? How do we do that, and how do we do it in a way that honors different perspectives and honors the needs of our patients? One of the things that that I'm just increasingly sort of drawn to is this idea of human-centered design, and asking patients what they want. Imagine that, right? But just the power that comes from sort of gauging what the true needs are. So, okay, that's great. But what is whole health really? Let's talk about that just for a moment. So here's kind of the VA's official definition, an approach to healthcare that empowers and equips people to take charge of their health and well-being and live life to the fullest. That's pretty broad, right? It's people-centered, that top purple pie slice. It's all about team work, but it's also about the well-being of the team. That means that, as a person who offers care, your whole health matters just as much as everybody's. It's not about, self-sacrifice to the point where your health goes as you're trying to maintain it in others. It's comprehensive and holistic. I always talk to people about letting there be room for more in the discussion. And that includes topics like, the well-being related to your surroundings, how you connect with others, what meaning and purpose, how that comes in. We talk about spirit and soul, but having people define what that means if they have a definition in their lives. It needs to be equitable and accountable. And it's also very upstream focused, as in, let's not just deal with problems as they arise, let's work to prevent the problems in the first place. And so, in a nutshell, exploring what matters and building engagement is huge. If you can go in and just talk to people, as much as possible about what matters to them, just take a moment to figure that out before you start a session or an interaction. That can take you really far, and it can lead to a really beautiful conversation. That also, I find as a clinician, really allows me to kind of create more of a healthy narrative around why I'm doing what I'm doing. Like, oh, this person here in front of me, it's all about being able to take care of their, aging partner, and they need to be at their best to be able to do that. And that's what really matters to them right now. Or, any number of other things, a goal like dancing at your kid's wedding, or I had one lady who wanted to be able to climb the ancestral hill where her family had lived in Ireland for years and years, and she just wasn't quite able to climb up to the house where they all grew up. She wanted to be able to do that. So just thinking about those kinds of things and making then the care, the whole person. It's great. Yeah, sure. Sometimes you just need to prescribe a medication for blood pressure, but there are often other things that come into play, right? Building meaningful interactions, co-creating shared goals. So having the person you're seeing kind of say what their goals are and moving forward. And I know for many of us on this call, that's kind of second nature to do some of these things. But trying to just be very intentional about this work is really key for everybody. Empowering, equipping. I love those words. We want people to feel like they can do it, and then we want to give them tools, resources, whatever they might need to succeed. And then, that's not all, folks. And we'll get into that. There are other aspects of this that I think come into play, and that's where we'll talk a little more about, what does it look like to transcend with care. So one of the things you'll see is the circle of help. This is the VA version. I'm going to go with the version that we've got here at UW. This is kind of how we modified it to kind of suit our intentions a little bit more. Not markedly different in some ways, but there are some differences. Me is at the center, right? Like helping that reminder that it's about the individual, the person who's there in front of you, cultivating things with mindful awareness. And then most of the acreage, as you'll see here, is dedicated to aspects of self-care. That recognition that you're with yourself 24 hours a day. So how can you work in these different areas? And just taking these one at a time, so as not to overwhelm people, but then looking at each of those as we move forward. Those are encompassed within conventional and complementary approaches, the things that others can help with, beyond the self-care side or to support the self-care side. And then again, holding it all together, holding the space is the community and environment piece. And all those add up, all those individual circles add up to whole health. And hopefully part of what this is doing is leaving room so that we can define this all sorts of ways or be very inclusive. And we know that at so many levels this can be helpful. As you think about what really matters to you and as you ponder this, which I think is great to do, and I'd encourage you all to just stop at that. Like what comes up immediately when I say what really matters to you, what really, really matters to you, and why do you want your health in the first place? I think sometimes we just kind of think of it as, oh, we want health because health is a good thing, but why? Taking the question a little farther. And this graph is just from a study that was, I think, pretty profound, just showing that people who rated themselves as having higher purpose live longer. Their mortality, that those lines are who is still alive, their probability of survival, and having a high sense of purpose keeps you alive longer. There are all sorts of pieces in here. I'm not going to belabor it too much in terms of the research, but just know that engagement is something where there's a lot of interest in some of the research now. How do you get people engaged in their care? And what we know from research around this is that choice matters, giving people choice and input, paying attention to their values matter. And we see all sorts of outcomes improving, and particularly with chronic challenges, ranging from COPD or pain or diabetes or fatigue, or if some of these other things folks are going through, digestive health issues. It can just be really impressive to see how people do well when we bring in values, bring in engagement. More reflection occurs, and people are more likely to follow through with the plan. Imagine that. If they help create the plan, they're more likely to follow through. And when we see data with things that 50% of prescribed medications are taken as prescribed, and some of these other things, that adherence to the plan, even with that, is so important, right? And then therapeutic presence is another piece, talking about what matters, but then doing everything we can. And again, I think this is second nature to many of the people on this call, but how do you make sure that you're doing everything you can to stack the deck with your demeanor, your presence for the other person, stack the deck in favor of them feeling better, right? So effective communication, bringing in the compassion and empathy, listening really well, from the clinician end, they'll say the average doc interrupts within 23 seconds, if not sooner, when they ask somebody how they're doing. And if you just listen, the studies show that you're more likely to get good information that moves the visit forward if you can just keep your mouth shut for a little longer. Mindful awareness, of course, so much going on there. We know positive role modeling makes a difference. Physicians and other clinicians who are satisfied in their work have more satisfied patients. Folks who are doing a particular healthcare practice are more likely to be believable when that practice is shared and encouraged with the people they're taking care of. And positive expectations, how much you bring in optimism. I think this is going to help you out. Simply saying that makes for better outcomes as well. So just thinking about all these different parts and pieces that come in. We have a personal health inventory here. Many of you have seen this. The link to it is here. We have folks fill this out before integrative health consults frequently, and just trying to gauge, in 2 pages. Doesn't take people long usually to fill these out, but getting a sense of where people are. And there are many ways to do that. One of the newer trends in the VA is they have an official definition of well-being, and then they have this well-being signs tool, which they actually use as a measure, kind of like collecting vital signs. And basically, yeah, the question is, and if you want, take a second to think about how you'd answer this. Consider the most important things you do or wish to do in your daily life. And if you're not sure which response to choose below, you just make your best guess. But then they have you rate, over the past month, on a scale from 0 to 10, none of the time to all of the time. How often are you fully satisfied with how these things are going? How often are you regularly involved in those things? And how well are you functioning at your best? How often do you feel like you're functioning at your best with those most important things? And those ratings can be really interesting, as you have the discussion about meaning and purpose. Where is a person with that? How are they feeling about being able to bring that into their lives? Because we can talk about it, but then, bringing it in a tangible way and having it where you feel like you can do it is a little bit different. And that's where well-being fits into the equation from the VA perspective, at least. And then we'll do a pause, notice, choose moment. Is there an area that calls out to you? And then setting the SMART, goal around that is one way to do it. It's something that builds, though, and ideally, it's something that occurs with the team. It's not just you do it with your primary care provider or you do it with your acupuncturist only. The idea in the VA is that everyone is aware of these goals and supporting people in attaining them. And that team is really taking on some interesting forms. And I think that's something we should continue to explore very closely at UW as we move forward. So elements of a successful team, right? And successful teams need clear roles. Everyone needs to be engaged and involved. There's this sense of everybody playing at the top of their game, all these different aspects, right? But in terms of the membership of the team, patients and their loved ones, the patient ideally, or the person ideally, is the captain of the team. The clinical folks. And then one of the things that I think has been really compelling about the work the VA is doing is that they've got now whole health coaches, or sometimes they'll just refer to them as health coaches now, and then peers, veterans who are trained to take other veterans through the process of exploring what matters and talking to them about the program and so on. And we know that peer support for any number of things makes a huge difference in terms of well-being, outcomes, satisfaction, and so on. Of course, we've got the complementary practitioners on the team. I think of that as personally the clinical team, but just giving a nod to inclusion. And then asking who else is helpful. And sometimes that who else, people in the community, it can be, members of clergy if someone belongs to an organized religion. It can be, any number of other folks too. So just kind of keeping that in mind and asking what do those teams look like? And then building this into a system, right? And the idea is that there's that they talk about this in the VA, that I kind of call it the whole health fidget spinner, because it looks like those old fidget spinners that were popular a while back. But three different aspects. So on the bottom right, there's the clinical care, the treatments, sure, the outpatient, the inpatient stuff, the things we usually associate with quote unquote conventional medicine. But it's also, other pieces, the recommendation for what to do next and so on. But then you've got these other aspects too. The pathway is, partnering with the veterans, peers, sometimes coaches might be in there too to create that overarching plan. And then there are the well-being programs, the different skills, the way we equip people to be able to move forward, coursework, other services that we offer, and so on. So lots of different possibilities, and trying to have those all sort of work together so that there's a plan out there that is broader than what you might typically see. And veterans are doing that. As I mentioned, these are the number of veterans per fiscal year who have some kind of whole health experience. Now, some of these might not be super duper elaborate, But this can also include all those who are receiving some kind of that list one, those different approaches or whatnot too. And it's just been very gratifying to see that jump from year to year in terms of number of lives touched. Now, mind you, there are about 9 million veterans in the VA, enrolled in the VA, and that's of course not all veterans, but it's still, we're talking about a third of the folks in the VA now are getting some kind of whole health related experience. And that's pretty exciting. And there's interesting research that's emerging, in terms of different types of screening and lab values and some of those things, doing somewhat better after exposure to whole health. And so you see these percentages that, as a general rule, not always, but tend to go up after whole health has been introduced to a clinic or to a particular community of patients in the VA. And it's interesting to look at the data, for example, A1C, right? Measure of how your blood sugars are doing. The pre-whole health and people who don't necessarily have whole health numbers vary quite a bit. And typically you'll see things trend in the right way. I do find it interesting though that often before these vertical lines are where whole health was really started, there's kind of a baseline where a lot of the clinics that introduced whole health that already had a higher baseline, even if they did see a jump. And there are some places where you just have to pause and ask, okay, that's great. Is your diabetes number then the end goal for whole health provision? I mean, even if my A1C stays the same, but I'm happier, I think that counts as a meaningful improvement too, right? So these are just some general measures. They do these on the fly with the VA. They're electronic. So basically, as these numbers come in, the data is constantly being updated, which is kind of interesting. But yeah, just interesting to see that we are finding people are doing better with a lot of the self-care. And there's other research out there. I've got the link, and there's kind of a research in whole health like summary on the website that kind of talks about some of the latest findings and the work that's being done. And some of that includes things like, imagine this: acupuncture, hypnosis, and coaching help people stop smoking. Whole health markedly increases the likelihood that people with PTSD will use various therapies to help with that, including evidence-based psychotherapies. There's more satisfaction and engagement. People say they like to work at the VAs where there's more whole health. It correlates pretty well. And so, this idea of working with whole health as a means for finding more fulfillment in the work of the people who are bringing care, and any number of other things. And I mentioned whole person health is taking off at the National Institutes of Health. I will say that their mindset is a little bit different. For them, you're talking about an organization that has all of these different institutes that are devoted to either different diseases or different organ systems, right? And for them, what they're trying to do is bring all that work together, which is no small feat. But how do the allergy people and the heart people and the women's health people and the gut people and everybody communicate, and how do we start thinking about the body on a broader basis? And so there's this idea of moving towards synthesis there, and then ideally coordinating more with beyond the person too, which I think is so important. And we'll get to that in a second. I love that this has been the product of transformative education. Some colleagues and I recently wrote a paper on, hey, education matters with this kind of thing. And I love that at UW we have such an educational stance, I guess you could say, and just these pieces, finding champions, really seeing what you need and what people need, creating courses and doing pilots, having like exemplary like groups or divisions or locations that want to try it, and then really bringing in change management, like exploring what does this mean for an organization and how do we do it so there's buy-in, and how do we do it in a very intentional way with teams, programs, the time that is involved, and so on. And then how do you circle back based on feedback you get? All these things come into matter, come into play when you're thinking about how to roll stuff out. So a lot that we can think about, every one of these steps can be something where we're doing additional work with whole health. And ultimately policy can be shaped by that. And momentum is important as well. How much are we moving this forward? How much are we getting things going? I mentioned, speaking of momentum, the National Academy of Sciences report. I'd encourage you to look at that. It talks about different groups, and so it talks about the VA and the work they're doing, but it talks about the NUCA program in Alaska and how that's working. It looks at an FQHC and I believe it's in the DC area. There's another program with geriatrics and whole health approaches from San Francisco. Worth a look just to see what's out there and how things are going on. And also just recognizing that there's this study, this report from the National Academies that's so supportive of this kind of a work. Similarly, the Southern California University of Health Sciences, which began really as a chiropractic school and has slowly kind of expanded to other programming like Chinese medicine and PT. They're working on nurse practitioner program and so on, but they announced that they want to be a whole health go-to institution a few months ago. And this idea that education and an entire university can be shaped in that way is fascinating. And as we're thinking about empower and equip, I just wanted to make sure folks had, a sense of some of these pieces, that links to resources, of course, including our mindfulness programming comes up all the time. You can't think about your plan if you haven't paused to reflect a little bit. And they'll sometimes refer to that as pause, notice, and choose in some circles too. And again, social determinants, working in the community with different resources. Community health workers have an incredible potential to contribute. And then just thinking about who else you're working with on a daily basis and how we communicate together, right? Because one of the things as we grow is that's a little trickier. Lifestyle medicine, functional medicine are coming into play with this. There are a lot of moments of overlap with whole health, integrative health, and so on, and also some areas where there are differences. But I think everyone's trying to find their way, and this model that I've been talking about is really kind of part of that. And, before we start talking about future state, I just want to say amazing things were afoot at UW. And many of you are directly involved in all these, but I just want to make sure that we just take a moment to pat ourselves on the back with all this. We're part of the OSHA Collaborative now, and all of that that means in terms of collaborating with other organizations, working together, seeing what they're doing, visiting with them, having gatherings. They'll be here the fall after next, with representatives to have a meeting here. Cancer care, all the great work that Dr. Dittis is doing now, and pediatrics, and Mala and everyone working there, the IBD, IBS clinics, the East Park Clinic, the work being done at the East Hospital, various types of research, and the list goes on, working with the community health workers, all these group medical visits that are being announced on a routine basis now, working with nutrition services and exploring possibilities with them, the work we do with the fellowship training and electives for medical students and others, and then just kind of moving toward, collaborations in other ways with lifestyle medicine and other groups. And just mark your calendars, our 25th anniversary is coming up here in a year or two. So a lot going on, a lot of beautiful work. Want to honor that. And as always, because this is the way it works, what do we need to kind of keep giving ourselves a little kick in the butt to move forward? And so thinking about that too. And, there are challenges out there. There are challenges to the work that we do, not just here at UW, but in general. I'm struck, many of you know, I took a few years to help kind of work with the medical school and design, whether or not they use it, we'll see, an integrative medicine, integrative health-based, whole health-based curriculum for our medical school. And coming back and being back in clinical practice now, I'm struck by how many changes are afoot. One of them is that there are different diagnoses cropping up more and more, including ADHD, which, is a fascinating one to think about. Is it tied into focus? Is it a natural characteristic of people? There's a lot of debate out there, but what I see is that a lot of people are paying attention to it. And that is great because I think a lot of people are finding benefit from doing so. We talk about other diagnoses like POTS, Ehlers-Danlos, just moving into the forefront more and more and trying to figure out how do we work with that. There are other sort of call them pathologies or challenges that I'm seeing a lot of or hearing a lot of discussion about too. Where there's the desensitization of things. There every day it seems like there's a new crisis or a new challenge or something hard in the news. I can't tell you how many people I've talked to this week who are doing media fasts lately. They're just trying to limit how much they look at the news because it's just such a kick to them, But this idea of extinction of experience, where, they talk about it in terms of environmental health. If you don't have experience of the outdoors or the world around you, you're much less likely to be as engaged with trying to do good in the world around you. Hypersensitization, I feel like there are a lot of folks who are very attuned, who are feeling very unsettled right now. We're dealing with disasters. It seems like every time you turn around, right? New things going on in the environment, LA fires and so on. I, we talk about ecological grief, eco-anxiety, and just a general sense of existential angst out there. There's this kind of a feeling that folks are just a little bit kind of weary or a little bit done sometimes. And so how do we help people with that, and how do we work with that in ourselves? And also, of course, violence and the sort of wake that it travels in. So, all of a sudden, all these different things start to feel like they're building up, and it can be overwhelming. So what do we do? What comes next is really the real question. And I don't pretend to have all the answers to that, but I really want us to reflect a few ideas out there um, about what comes next. And how does the work we do support bringing health and healing to the context in which we find ourselves? And so we're back to transcendence. I flipped the picture so it would look unique, but we're back to the dude poking his head out of the stars. And so again, transcendence define be or go beyond the range or limits of something, right? So it's both, kind of a sense of movement, but also a sense of presence or who you are or what you represent. Just moving it farther. And it's not to say that where we are now isn't great. It's not to say that it's all about constantly moving, moving, moving. It's not all about yang. It's about yin too. And what do we bring to allow ourselves to really make healing happen at these different levels? I love this quote from Heidegger. I don't pretend to be a scholar of Western philosophy or anything, but he said transcendence constitutes selfhood. This idea that moving beyond is what truly makes us who we are. It's not just staying in ourselves that allows us to truly grow or to become who we are. It's these moments of transcendence. And I think there's a lot of power to thinking about that it's just a fundamental need for human beings to explore that process or that aspect of who we are. And so there are ways that that's being done. This model, they expanded the circle in the VA, the whole me, whole we. We can't do it alone. It's not just about thinking about individuals. And in many cultures, they're just, they see this model of focusing on me at the center and think, okay, but, I'm focused on my family. I'm focused on how I fit into society. It's not just about ego and one person. And I mean, it is important, don't get me wrong, but being able to think about that in context of all those different things that go into affecting who we are, from the economy and the politics and the context of politics around us to, systems of power, how we're treated because of how we look, who we are, sexual preference, whether we're an immigrant or not, all these different pieces come into play. And recognizing that in order to truly think about whole health, we need to bring that in, which then takes us to entirely new levels with transdisciplinary teams and thinking about how society brings whole health in general, right? The social determinants, access and quality, education, economic stability, and so on, where you live, the quality of your housing, whether you have a home. So I just want everybody to take a second and you can put this in the chat if you want, but I just want you to think about where you stand on a few sort of different issues around this, on a scale from 1 to 5, where 1 is no way, that's not important to me. 3 is like, I'm indifferent. And 5 is like, that's absolutely important. And just reflect for a minute. I'm going to ask you 4 questions to think about. I've been thinking about these a lot lately. So number 1, healthcare should be goal focused. Should it, we talk about growth, we talk about that model, but then there can also be this challenge, right? Of feeling like it's all on you to be healthy, right? Versus like the broader milieu or the work of the community or working together and so on. So I just curious what people think, just reflect on that. Healthcare should be goal focused. And we'll give folks a chance at the end here to comment on that as part of the Q&A time. What came up for you? Number two, healthcare must focus on individuals first. Is healthcare so innately built around taking care of a person with a problem that that's just what it's all about, or are there other ways to look at it? And talking about a few proposals for that in a second, but healthcare must focus on individuals first. Doesn't mean only, but first. Okay. Healthcare should weave in big picture issues like planetary health. Is it appropriate, for example, for me when I see someone in my primary care practice to talk with them about what they're doing for the environment, quote unquote, or what they're, doing to handle, fear of disasters. And last but not least, we have an obligation to bring aspects of transcendence into our work. Is that something that has to happen? Is it appropriate for quote unquote modern healthcare to just, person comes in, their blood pressure's up, I give them a prescription for lisinopril, tie it up in a bow, and we're done. You know what I mean? So what do you think about those? And of course, I think I have a sense of what many of us in this group would say, but these are issues that are really coming into play now in terms of how we think about care in the future. Where does integrative health go? Where does whole health go? How do we truly make it whole? How do we truly integrate? And is it care for all? There's a lot of stuff out there. I've been working on this book chapter on the humanities and whole health being tied into the health of the planet. And you'll see these movements like eco health and one medicine and planetary health. I deliberately put the world upside down just because I think it's really funny that whenever in a movie, a spaceship approaches Earth or something, it's always oriented a certain way. I mean, if I came from another planet in a ship, why would the Earth be facing north necessarily? You know what I'm saying? Or even facing up or down versus sideways. Maybe Earth is this cool thing that rotates around away from you and then closer to you or something like that, right? It's just interesting how our perspectives can change. But there's a much more talk now about interconnectedness, globalization, how this all plays together. And, just this idea that if your planet's not healthy, if your environment's not healthy, it's kind of hard for anybody on that planet to be healthy, right? And there's hope. I saw this just recently, those kinds of things. You need those little moments of delight, like, oh, wow. Okay, so when we talk about transcendent healthcare, care that goes beyond in new directions, that leads to transformation and system change, it's revolutionary, innovative, travels new paths. What does that look like? And here's where I want to just pause. And I'm going to stop sharing for a minute and just encourage folks, just put something simple in, a story of transcendence, or raise your hand if you're up for it, and just share. Share something where you've seen something remarkable happen in your work or in your personal experience of health. So if anybody would like to raise their hand or share something, again, I want to respect, we've got about 10 minutes to talk about all this, but if you have anything that you'd like to put in there. And Greta, anything from the chat that I should be aware of? Because I've been talking a lot here.
A couple of things. Well, I just wanted to share, yesterday I saw a patient who has had a lot of different things they've worked through, and they thanked me for just introducing them to our mindfulness program and everything that's meant to them in their trying to work towards a better sense of wholeness in their own life. I'm just looking at there are any raised hands, but also there, Tanya Kroll, who is working with supportive services in oncology, was wondering if there's anything out there where cancer centers have infused the whole health model.
Yeah, great question. A quick answer to that is I think that we are the ones who need to lead the way there with our oncology work at UW. The VA, there are services, but they have not, to my knowledge, done a very dedicated oncology program yet. And I think everybody's kind of looking to see what that looks like still. So we need to show
Thank you. I'm so looking forward to working with you on this.
them. Absolutely. And I see Lisa's hand up. Lisa?
One sec,
Oh,
we'll get to,
sure.
but I just wanted to note that Jean mentioned that her family has benefited from VA Whole Health Pacific Islands. So a personal thank you to you, Adam.
Mm.
Go ahead, Lisa.
Um, I just have been so moved by my experience. I've had the great good fortune to co-facilitate some of the Mindfulness for Your Health group medical visits with Vinnie Minichiello, and some of the feedback that we received from participants in the groups has been just really moving. And in one case, a participant came back a week after our conversations to say that something that somebody else in the group had shared had literally saved her life, is how she described it. And it just really struck me that it wasn't something that I said or that Vinny had said, but something that unfolded in the context of the group and the group that had been forming over a couple of weeks. So that was, to me, that was like just pops out as transcendence and healing in a very surprising way for me.
There's so much power in how we hold the space or how we make room for those possibilities and the beauty that arises from people coming together.
Adam, Joanna was wondering if PAs and APPs are part of the clinical team for providing whole health at UW. Or I
Yeah,
guess that too, I guess.
yeah, absolutely. And I
Uh,
think there's more room for that. I think of, how much, for example, I have the pleasure of working with Sarah Suing at the Yahara Clinic, who is just this phenomenal PA who gets it, has been working her way through the fellowship and yeah, does remarkable things. And you see it too. There's more room, certainly, but I just see some amazing people doing their stuff in the VA too, and it's par for the course, when you think of the team.
And we also have Lisa Simpson, who's in a PA for 30 years in
Yep.
primary care, who is leading our group medical visit program and provides a couple of group medical visits. So yeah, our the borders of whole health are really like no borders. I used to say fuzzy borders, but like there's no borders, and we love to collaborate with whoever wants to collaborate with us, and we can help find ways to make things happen.
Yeah,
Thanks.
and I would even go so far as to say that we have to branch out as much as possible. As we talk about all these things, especially on the larger scales, the use the word transdisciplinary, approach matters. This is about bringing people together with experiences that, range from a wide array of different topic areas. So, or, levels or aspects or whatever of expertise, so pretty exciting. I'm always struck, when we were doing the whole health teaching, almost inevitably at the end of a course, a psychologist or a social worker or a nurse would come up and say, "Oh, great! I'm glad that it's finally moving in the direction that our organizations have always wanted to move. This is how we were trained." But it's not always reflected in the way things are done. So, but then what's lovely is those folks have kind of moved in, all these folks with these different backgrounds, that and wow, yeah, it has helped move things in all sorts of cool directions. It doesn't matter if the slides are showing, but just thinking about how do we transcend, how do we move beyond, and how do we truly do that in a way where we untangle things so we don't feel like we're compromised by doing this work, but rather empowered by doing this work, right? And so, when I think about where we go from here, we talked about bridging disciplines, thinking about the bigger picture. I think social awareness and advocacy are fundamental to this work, and when we're working with fellows or residents or others, exploring that, the community health side of things and so on. And just constantly thinking, okay, what can we do? And my last slide, I'll just read which is, I absolutely believe there's a reason for hope because of friends and colleagues like you all. So I'll stop there, but I really appreciate it. And I would love to hear more if, you have a chance to share just the, experiences that you've had over the years. I just, find that some of the most powerful moments, the things that keep me coming back to wanting to do this work are those moments where you realize you help someone in a way that they hadn't been helped before, and or give them space so that they can help themselves in a way that's not happened before. And that's really powerful. So yeah, I'll stop there.